Good afternoon, everyone. My name is Vin Kim Nguyen. I'm the co-director of the Global Health Center. I'm recovering from a cold, but I don't think I'm infectious anymore because it's been a while, but I'm wearing a mask just in case. I do not have AMR because I have not taken any antibiotics, so I'm a poster child for that. So I wanted to welcome you to this event, which is called the UN High-Level Meeting on AMR, Our Current Conflicts, a Game Changer. So this is not the actual UN High-Level Meeting, it's a meeting about the high-level meeting. This has been organized by the International Geneva Global Health Platform, the Global Antibiotics Research and Development Partnership, GARD-DP, and the Permanent Mission of Barbados to the UN Office and other international organizations in Geneva. This year is our 10th anniversary of the Geneva Global Health Platform, and I just wanted to highlight that we're quite proud of hosting many important meetings and conversations over the last 10 years, really through the lens of governance, power, and politics. So to give you a bit of logistics, the recording of the event will be available on the Global Health Platform website in 1 to 2 days at ghplatform.org. If you're watching this online, you will be able to find that quite easily. During the event, there will be 2 Q&A sessions with the audience. For those of you who are online, please type your questions or comments in the chat box, including any addressed directly to an individual speaker. And before we turn to Ambassador Wilson, I'm just going to give a few minutes explanation of what AMR is. So AMR means antimicrobial resistance, and it refers to the phenomenon by which bacteria learn, if you will, to become resistant or immune. They're not actually immune in the biological sense, but it's the equivalent of immunity to antibiotics and various agents that we use to disinfect in hospitals. So that's why we call it antimicrobial. Antibiotics are drugs, but there are many chemicals that have antimicrobial effects. Think of bleach, for instance. Now, the concern with AMR is that it is a growing public health concern. Already, probably 1.5 million people die every year from it, and it is growing at a very quick rate to the extent that it has become a major threat to global public health. We don't talk about it enough, but it is there. It is in our hospitals now. If you broke your leg and went to get operated in a Geneva hospital, you would have a significant chance of picking up an antimicrobial resistant infection that would be difficult to treat with the antibiotics we have. So it is a very real problem, even in our hospitals. And as antimicrobial resistance grows in proportion of infections, it threatens to reverse pretty much all of the advances in 20th century medicine. If we don't have antibiotics to treat infections, common infections like pneumonia will become lethal. Untreated pneumonia kills half of the people who get it without antibiotics. It will make life-saving surgery and anti-cancer treatments no longer possible because the risk from infection will be greater than the effect of the treatment. And it will, as I said before, make common infections deadly. So we're talking about something which is really a very real threat, and for which we have not yet found the solution. Now, why are we having this meeting? Well, there's been, in recognition of the global public health threat of AMR, there's been another second UN high-level meeting that seeks to catalyze funding and political will around this issue. I think it bears saying that the first meeting was not a success in those terms. And we thought it would be interesting to discuss the potential for this meeting to actually have a more successful outcome because of, paradoxically perhaps, because of the current conflicts in which the world finds itself embroiled. Now, something that many people may not know is that conflicts, wars, are major human drivers of antimicrobial resistance. I should just say here, human I mean by inhumans. Most antimicrobial resistance is driven environmentally by antibiotic leakage into the ecosystem, particularly from animals, chickens and pigs mainly. So conflicts, and the current conflicts, are very, very powerful drivers of antimicrobial resistance. We've seen this in the Middle East. And in fact, the interest in antimicrobial resistance in many ways started with the wars in Iraq, and the observation that many soldiers were coming back to the US with multi-drug resistant infections that were very difficult to treat. So given that, is there a chance, is this actually an opportunity to highlight the security threats and the threats to human health more generally? Will that opportunity, can it be used and taken to improve funding and generate global attention? So we'll start with a video statement from Matthew Wilson, who's Ambassador and Permanent Representative of Barbados to the United Nations, WTO, and other organizations in Geneva. He is a co-chair of the Global Leaders Group on Antimicrobial Resistance, and they have been playing a crucial role in the global AMR conversation.
Mr. Vinh Kim Nguyen, co-director of the Global Health Center and professor of anthropology and sociology at the Geneva Graduate Institute. Mr. Damien Some, External Affairs Manager, Global Antimicrobial Research and Development Partnership. Thank you and the Graduate Institute for co-hosting this event in Barbados. I'm sorry I could not be there with you in person, but it was so important for me to speak on this issue, given the role that my Prime Minister, Mia Motley, has played in focusing the spotlight on an issue that far too few think about, but on which far too many are affected. We will all be touched by issues around AMR in the future. It is almost inevitable with what is happening. An increase in potentially fatal pandemics and viruses, and a decrease in the investment going to the research needed to protect us all through the development of new forms of antibiotics. It is also critical that we're having this discussion here in Geneva. We often hear the adage that Geneva is the kitchen while New York is the restaurant. I think with the presence of WHO, the Global Fund, Gavi, and many other international organizations and research centers right here in Geneva, we can say Geneva is the laboratory and New York is the pharmacy. Coming on the heels of the high-level meeting on antimicrobial resistance, which was held in New York in September, we must leverage the momentum to focus on implementation of the political declaration adopted during that meeting. To put in context the fundamental nature of our work over the next few years, in 2019 alone, AMR was directly responsible for 1.27 million deaths globally and contributed to 4.95 million deaths, with children under the age of 5 accounting for 20% of those deaths. Let these statistics sink in for a second. Faced with these numbers, we have a global moral responsibility to do more. Without immediate and concerted action, AMR could cost the world an additional $1 trillion in healthcare by 2050, and as much as $3.4 trillion in lost GDP annually by 2030. So if the morality does not move you, then let the economics of it do. Just let something move us into action mode. The political declaration that was agreed to a few weeks ago serves as a roadmap for the international community's work over the next 5 years, with concrete commitments on governance, financing, and access, as well as the pillars of the One Health approach: human health, agriculture and animal health, and environment. It is a recognition of what we, the global community, have achieved since 2016, as well as a barometer that more can and must be done to ensure that AMR is tackled equitably, particularly in developing countries, including in low and vulnerable middle-income countries. We have set ambitious targets, not because we want to, but because we need to. We must reduce global deaths associated with AMR by 10% by 2030. We must foster collaboration between members and other stakeholders, including the private sector, and partnerships such as the Global Antibiotic Research and Development Partnership, to take steps to increase global access to and appropriate use of antimicrobials, and we must enhance coordination among all the relevant stakeholders, including financial institutions. We must meaningfully reduce the quantity of antimicrobials used globally in the agri-food system by 2030. We must raise a modest target of $100 million to catalyze the achievement of at least 60% of countries having achieved funded plans by 2030. We must collaborate with financial institutions to map existing and catalytic funding from a diverse array of sources. We must provide a progress report on the implementation of the political declaration at the UNGA in 2026, and we will seek to hold the next high-level meeting on AMR in 2029. I'm heartened to see that our collective work in the international community has significantly enriched our comprehension of AMR and given it the platform that it deserves. The work of public-private partnerships, governments, academia, funding agencies, the pharmaceutical industry, and philanthropic organizations must be turbocharged now. We need to work with the same level of alacrity and scale proportionate with the threat that AMR presents. We cannot stand still against the statistics and the forecasts. The government of Barbados looks forward to working with all of you in the AMR ecosystem, including the quadripartite organizations, to not just place a spotlight on this issue, but to raise the heat. I wish you a successful conference. Thank you.
In our team, we've been doing research work on antimicrobial resistance. And really the motivation for holding this meeting today was exactly as Ambassador Wilson has said, to keep the momentum going between UNGA and the forthcoming meeting that will be held at ministerial level in Saudi Arabia, and then hopefully momentum going into next year, to keep this topic, which, as we've just heard from our different interventions, is just so urgent, but perhaps not adequately understood by the general population, of the risk that we all sitting in this room face from AMR. So I wanted to credit the Prime Minister of Barbados, who has been leading the Global Leaders Group on antimicrobial resistance, and Barbados and Malta's work in bringing the member states together to get the political declaration passed in New York in September. And I would like to just share some of her words. So she has said that the political declaration is a blueprint for action, but she has said that the hard work starts tomorrow. So that's what we're here to do. And we've brought together an amazing panel of people with different perspectives to come and share with you the work that they will be doing to further this issue. It's important to underline that other groups of people were involved in New York, not just our politicians and our member state representatives, but significantly AMR survivors, a big group of patient representatives and AMR survivors, and many other civil society organisations. And that's where those of us that are not necessarily involved in the clinical or political space are very important to advancing this agenda. So the breadth of the parties that are involved highlights the complexity of this issue, this slow-moving and sometimes called silent pandemic. So I'm delighted to introduce our distinguished speakers. I won't go through their bios in detail because you can access those on the website. Certainly the people joining us today online, you'll be able to see that easily, and for others, this is available. Firstly, I'll invite Dr. Kefas Sampson to join me. Kefas is going to represent the four-party collaboration, which is really a unique collaboration that has been put together of different organisations working on AMR, again underlining the complexity of dealing with this issue, which goes across human, animal, agriculture and environmental health, which needs to engage across stakeholders. And this quadripartite secretariat, which has emerged from the high-level meeting with a strengthened mandate for action and with a clear funding target for the work that will be done. Secondly, I'll invite Mr. Damien Sommet from GARD-P. It's an even bigger pleasure to invite him because he's an alumni of this institute and studied here, so we're very proud to have him back in his professional capacity. The Global Antibiotic Research and Development Partnership works on developing new antibiotics that we need to fight these resistant infections that Professor Nguyen explained to us. If you go to their website, you have some pop-ups which gives you some very frightening numbers of over 3 million AMR deaths already this year, AMR-related deaths already this year, and one person dying every 6 seconds. So this really is an issue that we need to convene around. And lastly, I'll invite Professor Richard Sullivan, please, to join us, who is going to share his unique perspectives as a clinician and as a researcher, and help us understand why this critical global health challenge is exacerbated in our increasingly conflicted world, and why AMR matters for everybody. We're going to have space, as was mentioned, for 2 rounds of audience questions, so I'd really encourage the people online, please add your questions. I have an iPad where I should be able to see them. And those online, please write into the chat, and your questions will appear for us to share. So, if I pass to our panelists. Dr. Sampson, I would like to ask you, please, firstly, to explain the work of this unique quadripartite organisation. Why has it been so important to bring together all these different multilateral organisations to work together on this topic?
Okay, so it's working. Thank you very much, Nadia, and thanks for the organizers, the Geneva Graduate Institute, for organizing this and inviting us to share our perspective from the Quadripartite Joint Secretariat. I will start by saying that, not to overstate, but I think it's important to say that this year, 2024, has been the year of AMR. And that is because we had the high-level meeting, which has just been concluded with what you also said in the words of Prime Minister Motley, is really a very powerful political declaration that will help us shape the global response to AMR in the coming future. And not only that, but we have this unique opportunity also that next month, the Kingdom of Saudi Arabia is hosting the 4th Global Ministerial Conference on AMR, which aims to take from the declaration to implementation. So the theme of the conference is translating the declaration to implementation, which is really unique in a sense. Now, coming to the Quadripartite Joint Secretariat, just to explain that this is a cooperation of 4 organizations that actually have mandates in 4 different sectors, so to speak. And we have the Food and Agriculture Organization of the United Nations, or FAO in short, which is concerned with dealing with food production, or in short, the agri-food systems. And we have the United Nations Environment Programme, or UNEP for short, which deals with issues of the environment and climate and so on. And we have the World Health Organization. That's the organization that I represent, which of course, deals with health sector issues, anything to do with human health. And we have the World Organization for Animal Health, or WOA in short, and they deal with animal health and welfare, and that also includes not just the food animals, but also domestic or companion animals as well. So these organizations came together and signed a cooperation agreement through a memorandum of understanding in 2019, first to form the tripartite and UNEP, but then in 2022, UNEP actually signed formally to join, and it now became the quadripartite organizations. So the Quadripartite Joint Secretariat kind of consolidates this cooperation between these 4 organizations and is hosted within the WHO here in Geneva. Now, why are these organizations having to come together? And I think that's the question Nadia is asking. And it is predicated on the fact that the drivers of AMR lies within the health sector, It also lies within the activities of the agri-food system. It lies in the animal health sector, and the environment is actually kind of the collection point for everything. Now, you have activities on the farm, use of antibiotics to treat farm animals, in some cases also used for growth promotion, which is heavily being discouraged, and also traction is being realized in that direction. And we have also manufacturing plants for these antimicrobials as well, and we have effluents from those plants contaminating the environment. We have waste from healthcare facilities that could contaminate the environment. Inevitably, there can be resistant bacteria within those wastes that gets to the environment, and then the farms as well. Then the cycle continues. So given that no one sector can actually act alone to contain this problem, then it became imperative that there is need for this cooperation and to leverage the mandates of these organizations who have some kind of connection with member states, supporting them in their own sectors. But if they keep to their separate sectors, then we cannot have really comprehensive and concerted efforts to really address the problem from the multiple fronts. So that's why it is encouraged to have the multi-sectoral coordination and collaboration even within countries, but most importantly within these organizations that are supporting at a global level. So everything it becomes kind of in sync.
So coming out of the high-level meeting in New York, the role of the Secretariat has been, I want to say elevated. You probably would be too modest to say that, but it certainly looks that way from reading the political declaration, has really been elevated in being a real engine room of action. So what would you say are going to be the key priorities for you coming out of the meeting now?
Yes, without question, we are really glad to see that the role of the Quadripartite Joint Secretariat was not just recognized, but also we have been kind of requested to actually support in many fronts, particularly in seeing that the political declaration commitments are implemented. Now, of course, the priorities of the Quadripartite Joint Secretariat and the Quadripartite organizations will now focus on making sure that we can deliver on supporting member states to implement this declaration. Of course, as has been mentioned, there are commitments in terms of strengthening global governance. There are commitments in terms of financing. There are commitments for health sector targets, for animal health sector targets, and agriculture and the environment. So we are all cognizant of that, but also in total monitoring the achievements and the progress by countries, helping countries to build capacity and to drive this impact at country level. So this will, and most importantly also, recognizing that partnership is critical to achieving this impact. And therefore we are positioned to also drive partnerships and ensuring that access to antimicrobials can be ensured, but at the same time, the misuse and overuse of antimicrobials can also be minimized. So all those priorities will be geared towards ensuring that the political declaration is delivered.
Thank you very much. And that's a very nice transition to talk to you, Damien, about, as you just mentioned, the appropriate use and the availability of appropriate antibiotics to be used appropriately in care. And GARD-P is a very unique organisation in working towards developing new antibiotics, but really also focusing on global access. So not in a commercial environment, but a product development partnership. So could you help us to understand why we need new antibiotics and where we need these new antibiotics most critically today?
Thank you very much, Nadia, and thank you to all the organizers. I think we have heard by now why antimicrobial resistance is a top priority. as one of the top 10 global health threats, as evidenced by many reports, and all the organization and the UN high-level meeting have stressed over the relevance of this issue. So let me speak about the need for new antibiotic to counter antimicrobial resistance and GARP's role within this endeavor. I would like to start with a reminder. I think some of those who follow closely the history of antibiotic development usually refer to the years following the Second World War as the golden age of antibiotics, when dozens of antimicrobial substances were discovered. However, since the 1960s, the discovery of new antibiotic classes that actually made it into new drugs had slowed drastically. In this context of a dry pipeline, the quest for new antibiotics is of paramount importance if we want to address the failing pipeline and tackle effectively AMR. And this is precisely one of the reasons why the Global Antibiotic Research and Development Partnership, GARP, was created in 2016 by WHO and the Drug for Neglected Diseases Initiative, the NDI. So GARP's role is to accelerate the development and access to much needed antibiotics that target the priority pathogen list, as I mentioned, the priority pathogen list being this list established by WHO that lists the most deadly pathogens. So that's about GARP and what we do to contribute to address the issue of antimicrobial resistance.
And how challenging today is the funding environment?
Well, I think, you hear it times again that drug development is first a lengthy and a very costly endeavor. It requires a lot of funding. And currently what we see is that the public and philanthropic funding that support AMR research is, one, insufficient and inadequate. Why is that? Because we need adequate funding for all stages of the drug development cycle. So we need funding across all these stages to be able to keep pace with the resistance. Because if we have enough funding to cover all cycles, including the early discovery to the late stage clinical development, where we take the most promising molecule to make them ultimately become treatment, we will be able to cover the full cycle, and this is what is needed. So adequate funding and reasonable financial incentives also. In addition to the financial incentive, I must say, there is also a need for a concerted effort to address the needs of particularly vulnerable population and countries for which the research, the development, and access is often delayed or neglected or even ignored. So this is something really important if we want to tackle AMR globally. Of course, the push and pull funding have an important role to play here in stimulating basic research and also providing incentives for the industry. However, it's important to know that this kind of funding cannot necessarily guarantee that the right antibiotics are developed and that they reach the people who need them the most, as I just said. So that is one of the reasons why public-private partnerships such as GARP and others are very critical in trying to find solutions.
Thank you. Yeah, and Prime Minister Motley in her comments in New York also mentioned that in the year 2000, there were multiple large companies involved in antibiotic development, and now there are 4. And she clearly said, we, the world, cannot continue just to depend on 4 companies, apart from the initiatives that are taken in the public-private space and in the small and medium enterprise biotech space. We cannot rely just on 4 large companies to be involved in this space. Thank you. I'll just remind the online audience to please put questions in the chat. I'm going to ask Richard to make some remarks, and then I will come to the Q&A, the first session of Q&A. So we're going to ask you the big question, Richard. Is conflict a game changer for AMR? We've seen the United Nations world and our political world come together. We've seen the quadripartite secretariat elevated in its role for the next phase of work, let's say, on the topic of AMR. But in this incredibly difficult, conflicted world, is conflict going to help us to unblock some of the blockages that we've discussed already today?
Nadia, thank you very much, ladies and gentlemen. A great pleasure to be here, and thank you to Vinkim and colleagues for asking me. I think my colleagues probably reflect an important moment in the UK community. We've just had a major meeting at Wilton Park with all the biosecurity experts, where we focused on issues of conflict and insecurity vis-a-vis antimicrobial resistance and other high-threat infectious diseases. So some of my comments are going to reflect really some of the outputs from that meeting. So in short, the answer is yes, it is a massive game changer. Conflict ecosystems now, I would argue, are probably one of the biggest bioincubators we have on the planet. And it's really important to really focus on what I mean by this. If you look at the World Bank Group, you will see a list of countries that are listed of in conflict or fragile. The reality is there are far many more countries than are on the World Bank Group which have significant armed conflict and insecurity issues. If you count them up, we're talking around 2.4 billion human beings, representing about 30% of the global population, now in conditions we would consider to be in conflict. And what we're seeing, of course, is the nature of conflict has dramatically changed over the last 20 years. And why is that important? Well, the emergence of multi-drug resistant organisms, AMR, is really a complex adaptive system. And I think everybody in the audience understands what I mean by that. When you think about conflict ecosystems, they are the single biggest driver for complex adaptation. What we're seeing with conflict now is the increasing use of heavy munitions, fighting in built-up areas, and also degradation of the environment due to the conflict. Wherever you look, whether this is the Sudan, the Sahel generally, Gaza, Lebanon, the wars of Iraq, we can go on, and Vinkim's already alluded to this. The point being, we're also seeing extraordinary toxification of the environment. So when you look at the use of heavy weapons now, for example, at the moment, every single day, about 5,000 to 6,155 millimeter shells are dropped on Ukrainian or Russian lines. Now, these contain about 10 kilograms of RDX TNT. They contaminate the grounds with heavy metals. And that is just the shells, never mind all the propellant contamination that's going on from the other types of weapons. So generally what we're seeing is the physical ecosystem is getting contaminated. And heavy metals, complex carcinogens are mutagens. And that is driving AMR within the environment. The second order effects are also extraordinarily dramatic. And we know the normative effects in terms of the destruction of water, the personnel, but the clinical environment, the contamination of individual wounds, and as a surgeon, I see this all the time now. We see individuals with shrapnel wounds, dirty wounds that last days and days, not weeks. They create biofilms. We inadequately debride those individuals, and they provide perfect clinical microenvironment for MDRO to come out. And you look at studies of surgical site infections. In most conflict situations, 70 to 80% are contaminated with multi-drug resistant organisms. So this is a huge, huge problem. And I would argue, actually, it's not been that well recognized. Within the declaration, it's alluded to if you read between the lines. But as an ecosystem as a whole, I think it's a really, really big missing point. As I said, it is a massive bioincubator.
And some of the earliest papers in academic research that came out of the consequences of the Iraq War, for example, really highlighted how when service personnel were transported back into other healthcare environments for treatment, the infections moved with them. And so maybe you could help people to understand also why this is not just an over there problem. This is a problem that's coming into, all our health systems everywhere, wherever we are.
I mean, sitting here right now, you can feel an awful, awful long way away from conflict. And people don't understand really the therapeutic geographies of how people, patients, animals, etc. move has changed dramatically over 20 years. And as you were alluding to, back in 2004, we started picking up multi-drug resistant organisms in returning service personnel from Iraq. We've seen this again and again. It's interesting how a lot of the surveillance data, the isolates that we pick up, are not often picked up in the country where the conflict's taking place. It's picked up elsewhere. I'll give you an example, a contemporary one, Ukraine. The first data that we picked up that there were significant problems happening in Ukraine, and this does predate the war, but it's just exacerbated, was the Netherlands, where we started picking up patients and producing isolates, and I jotted these down here. We started picking up multi-drug resistant Klebsiella against two particular enzymes, NDM and OXA48, which are, trust me, this is, if you don't understand the clinical significance, that's really serious. Most of the gram-negative infections we were picking up in the Netherlands were resistant to meropenem, a really serious antibiotic that we use. And so what you see is as patients migrate across borders, AMR migrates across borders. So the interconnectivity of the world generally to ecosystems, when you think about it, we're really only 1 or 2 orders away from most major conflicts at the moment around the world, irrespective of how stable or permissive your environment's in. So the idea that somehow, if you're far away from a conflict, you are protected from the transmission of multi-drug resistant organisms is a complete and total fallacy. But I don't think it's something we've really talked enough about.
Thank you. So I'm going to come to questions, but we have one online actually, which speaks very much to what you've just talked about, Richard, which is a comment and a question that comes from MSF, Médecins Sans Frontières. And they're talking about exactly how this is not taken into consideration enough by all the different humanitarian actors who are acting in conflict zones. And they would like to ask, I would like to hear where the panelists think these advocacy efforts should be placed. Is it something that the UN should take on? How to engage other humanitarian actors on the topic, as well as engaging more AMR actors to focus on humanitarian settings? So I don't know who would like to make some comments in response to that question, and then I'll come to the room for the next question, please, if you prepare yourselves.
Okay, thanks, Richard, for elaborating those key issues surrounding AMR in conflict. Couldn't agree more. But another issue also is the fact that in a conflict situation, it's so difficult even to deliver treatment. And it's also complicated by the fact that in that kind of setting, even the regulatory systems don't work. And it is difficult to collect even data to inform proper decision making in terms of what is needed. So the complexity is really there in terms of AMR and conflict. Now, talking about how can the advocacy be elevated, I think is the responsibility of all. And what is evident in the process leading up to the high-level meeting, I mean, in terms of our consultation with key stakeholders and so on, and everybody agreed that there's not much in terms of awareness and understanding of the scale of AMR. So in the process of engagements, what we try to do is also to bring in people that really have lived through this experience, and then it begins to sink. When people narrate their experience, then it sinks very well to some people coming to terms with really this has a human face. So even at the high-level meeting, there are 2 AMR survivors that spoke, and I believe it was very compelling, and some side events as well. Now, so that brings to the point that it has to be everyone, whatever opportunity that is there, especially civil society, to actually be engaged, scale up the advocacy, and actually advocate for this. Now, again, the quadripartite have, in 2022 November, launched what is referred to as the multi-stakeholder partnership platform. And that includes, like 5 clusters, including governments, including UN and other multilateral and bilateral entities. It includes the private sector, it includes academia, and so on. I think it is an opportunity to have this message cut across all these clusters so that together we can amplify these voices. Thank you.
Thank you very much.
Yes, I couldn't agree more. As stated, we really need concerted and coordinated advocacy, to be able to elevate the implication of AMR, the implication of conflict for antimicrobial resistance. And I think having heard about how some injuries or wounds during the conflict led to drug resistance, I think one valuable lesson, in my view, in terms of advocacy, would be from now and moving forward to see how we factor conflict into our science, policy, and thinking moving forward, because this is important. If we fail to do so, as we just learned, we may be missing a critical component of the person, and this is just something we can't afford, given the magnitude of the effect of conflict. And also, I think this also suggests that even that now that we're talking about the 5 million deaths directly linked to AMR, if we were to factor conflict into that, we may see that these numbers are drastically underestimated. Exactly.
Because, as you said, the numbers are not being counted.
Yeah.
Richard?
Yeah, I totally agree. This underestimation, and I just want to inject some sort of sense of also the trouble with money at the moment and funding. Yeah. We're seeing dramatic cuts to ICRC budgets, MSF's under pressure, national funding mechanisms. I'm sorry to say this, we're off the boil in many high-income countries in terms of funding AMI research, when you talk to my academic colleagues. And more importantly, this one declaration against AMR is up against vast numbers of other calls for funding, from everything from cancer to climate change. So we are in a bit of a logjam, as people have said, when it comes to funding and replenishments. I think the issue is, and my colleague, Dr. Ala Abara, Imperial College, who works at MSF, done some fantastic work on that. I really recommend the work she's done, particularly in Syrian conflict, is working together in a cooperative manner to address some of these challenges and to come up with what I consider to be progressive, realist solutions. I think a lot of stuff gets chucked around as potential solutions that we look around from a conflict perspective. We think it's never going to work. But that's going to require UN, that's going to require NGOs, that's going to require serious, academic units to work together properly. And I think we're still at a very early stage in finding those sort of joint responsible programs that are really going to focus on solutions. That's just my read.
Okay, thank you very much. Is there a question in the room? Second. I'll take the question behind you first, and then family hold back.
I try to speak loudly.
You have a microphone here.
Good.
Thank you, sir.
My question is, in this partnership, where do you see the industry? Because when it is development of new products, there is an incentive for that. But I think you would perhaps agree that a lot of the issue is because of irrational use of the current products which are there, which are leading to the resistance. Similarly, I think taking the experience from treatment of diarrheal diseases, then COVID, an important element was mass education of the people. So civil society, this thing, not just for advocacy at top level, but how do you change the behavior of the public? And I think I'll stop there.
Thank you. So industry, we alluded to in our comments, the incentives are problematic. So maybe Damien can.
Yeah,
they're not working at the moment.
I think the industry has a role to play because they usually have the expertise and the know-how. And as we said, push and pull incentives are all needed. I think in practice we need push and pull incentive combined in a mix or alternative financing models to sort of incentivize the industry to play the role that it can play. Learning from the experience of GARP, we work with small biotechs and other SMEs to kind of bring together each of our comparative advantage to address the drug development process in a most effective and cost-efficient way. So I think industry has a role to play.
Thank you. And in terms of elevating civil society's voice, I mean, that's one of the reasons we're here today, but more institutionally, what would you suggest?
Yes, I did mention about the multi-stakeholder partnership platform for AMR, which is being nurtured by the Quadripartite Joint Secretariat. However, it is like an open partnership. And like I did mention, it also includes a cluster for the private sector. And the whole idea is that, you know, it is difficult, for example, for, let's say, you know, WHO to be aligned with private sector in a kind of way that may be perceived as conflict of interest. But in such a partnership, you know, it's broad-based, it's inclusive, and the private sector can actually fully express its role and also the needs and the requirements for that sector, and which will be appreciated by the other sectors. It also includes donors. There is a cluster for donors. So that is an arena where, you know, it brings all the ideas together. And I would suggest that, you know, this partnership is something that maybe the private sector should have active engagement in it.
Thank you. Richard?
To that gentleman's comment, I would like to think in my heart that through public health, behavioural changes, more insight, we can slow AMR down or even turn the ship the other way. But in my head, that feels like the triumph of hope over experience with the problems we currently have from a sort of geopolitical, socio-economic perspective. And the issue comes down to Damien said about biopharmaceutical industry. The problem is biopharmaceutical industry is heading towards island oncology. If you look at the portfolios of new molecular entities in the pipeline, they are throwing money at oncology drugs, okay? It's about 85-9% of the pipeline now. And so how on earth you incentivize them is a massive problem to turn this juggernaut around. So the question for me is, what about national programs? Why can't you have nationalized medical countermeasure approaches? But in that sense, we are then having to kind of deal with the other element of the security issue here, which is the geopolitical contestation with places like China, which are major innovators as well. And somehow then we have to find ways of cooperating at national to national levels on medical countermeasures, including antibiotics, that put other conflicts to the side. And I just don't think, to be honest, there's not an easy answer for that. I think you're right, the incentives aren't there for pharma, but it's a much bigger problem.
Thank you.
Right.
So I wanted to actually rebound on that, it's a French term, but respond to that with a question that's been kind of a subtext here and is I think a question we can ask in Geneva, which is about the geopolitics of this. There's a geopolitics of conflict that we are familiar with. We're also familiar, and we've seen in Geneva how there has been a breakdown of, we'll call it multilateralism. We've seen new groups emerge, for example, in the pandemic treaty negotiations. Terms have been bandied about, like decolonizing global health. I'm just curious to hear about how is AMR playing out in the geopolitics of global health? I'll leave it open-ended like that.
Yeah, maybe I can speak to our experience in the process of this high-level meeting. Because as you know, it is a very lengthy process, a very consultative process, iterative in nature, involving different stakeholders as well as member states. It's essentially a member states process, and therefore we see some kind of unity around AMR, although there are some aspects. For example, I think Richard spoke to the fact that the declaration did not so much address the issue of conflict. Some of the reasons why the silence was broken during the negotiation process had to do with that, whether or not it was adequately addressed. But broadly speaking, we can say that there has been some unanimity within the international community and member states to see AMR as what it is, a real threat to global health, and which requires very urgent actions and which requires really bold commitments. So just to put in perspective, when the declaration was approved on the 26th of September, it was rapidly approved without objections from any member state. Now, we also understood that this week, when the formal resolution of the General Assembly is now being adopted for this declaration, the adoption was made by consensus rather than by a vote. So to that extent, there is some kind of consensus, and we hope to scale up global advocacy to ensure that that remains, because again, AMR knows no borders, and therefore no country is safe until every country is safe. So on that basis, we can say there is some ray of light at the end of the tunnel.
Well, I think that knowing the global threat that we face, that our concern and commitment to humanity could transcend any geopolitics that may be. Global health equity should, for me, should go beyond the current, if any, geopolitical tension that we're seeing. And to do so, I think we need to care for also access to antibiotics and treatment to wherever it is needed, that this access is guided by the public health need and not by where you are, which geography, and your purchasing power, so that we put global health equity once again at the center.
Thank you. Richard.
I'm reminded that foreign affairs, what was it, the non-aligned world. And I think it was Antonio Guterres said we live in an unhinged world, I think at the UN Assembly. So this is the reality we have to live with at the moment. And I think, there is a need for some more progressive realism. A lot of this is going to be tied up in the behaviour around development and global health funding as kind of indicators of intent more generally. I do think that, a lot of this also seeps into issues generally within individual countries of trust, because at the end of the day, we are dealing with patients' data. We're talking about biological samples. We're talking about advanced analysis. And there is, as we know, in many countries now, a real loss of trust post-pandemic with what we are doing with that data. And fundamentally, if we're talking about nosocomial surveillance, if we're talking about understanding the nature of the spread of the problem, this requires cooperation, which is something that if populations are not going to buy into because they don't trust what we collectively are doing, we're going to be in real trouble. So I think it goes beyond the sort of the geopolitics generally into just the fundamental changes, I think, that conflict has brought to the trust ecosystem of citizens living in those countries' areas. So I think at the highest level we can possibly do something. Whether that filters down into the meso level is a different matter altogether.
Yeah.
Thank you. So we've got, I think, we've got lots of questions in the room. So maybe I'll take one more now, and then I'll ask you if you wouldn't mind holding your questions for the next question session.
Yeah, thank you very much for the presentation. I have an umbrella question, I would say, and is to have a little bit of view on in terms of what we expect from the independent panel and how that is going to be structured. And linking it to that, would that help policymakers, especially governments, to be able to base their national programs to have the evidence that is required or that is missing in terms of how to implement it without taking into consideration the financial implications of that. And then going a little bit more onto the patients, what do we need in terms of science? Because funding it will not be, is not something to discuss when we are in a healthcare facility and we are using last resource antibiotics. What are the gaps that we are facing, especially those ones who are in the field? Thanks.
Do you want to start with the bedside, Richard, and we'll come back this way this time?
Where do you start? I think it's just across, again, this is very ecosystem dependent. It's across the board here. In some cases, it's surgeons not being trained to properly debride war wounds. In other places, surgeons know exactly how to properly debride wounds, but just can't do it because the situations they're in. It's about antibiotic prescribing as well. And fundamentally, it's, if Ala was here, she would say about also understanding the nature of what you're doing, microbiology. Having the right kit and the right individuals there who know how to provide the support is critical. And if you look in most conflict situations, that's absent, even if you have excellent surgeons, excellent gen med. And that's a really big missing piece there. And my colleagues on the Lancet Commission on Diagnostic will argue we've still got a long way to go in getting what I consider to be decent, hardened kit, which is affordable, into conflict ecosystems, which are very, very hard work on any form of equipment. And for those of us, I'm not going into the technical details, have worked in those environments, a lot of equipment just falls over. Now, that is an evolution in diagnostics. So it's kind of a multi-layered problem. But again, you need the work at the local level with people to work out what the implementation gaps are and how you're going to solve those, because it's not one size fits all.
Yeah, so with regard to the independent panel, as you know, this is one of the commitments also in the political declaration, requesting the quadripartite organizations to, in consultation with member states, work towards constituting this panel and enabling its function. Now, this is a task that the quadripartite is poised to take forward very seriously and expeditiously, because also there is a time frame. We have to have it done within 2025, which is not far from now. Now, the exact, let's say what could be, the role of this panel. That is something that I can't say is decided, because again, it has to be in consultation with member states and other stakeholders. It has to be by consensus of what this panel should do. But basically we know, Richard spoke to the fact that, there is this trust issue. And in order for 4 sectors basically, but also, it can be multiple sectors. You cannot do, contain AMR, for example, if you do not include the ministries of finance, if you do not even include the ministries of national planning in most of these countries. So you need really multi-sectoral approach beyond even the 4 sectors that I initially mentioned. So to gain the trust of all these sectors, it was kind of thought that you need an independent evidence panel that will look at evidence and synthesize evidence across these sectors independently of the interests of any particular sector, and then put together everything and bring it to member states to make an informed decision. I know some of the contentious issues that were discussed within the declaration document. Some of it, member states declined to set targets on them because they said, we question the evidence underpinning this request. So we're not going to set targets. So in order for member states to be enabled to really make informed decisions, it was thought that the independent panel is critical. Now, setting it up, the quadripartite will start off the process. It will be consultative. It will include member states. It will include so many stakeholders. The exact form of it will determine the exact form of the panel and the exact terms of reference that the panel will use. So I think that's what I can say as of now.
Thank you. So I think, we've had some absolutely great questions which have touched on some of the topics that we were planning to talk about in the second part of the panel discussion. So I think I'm going to ask all of you a different question which we've alluded to, from whether it's from product development, whether it's from development aid, this financing question. So 100 million has been put on the table as a commitment coming out of the New York meeting.
Yeah.
But coming out of the 2016 first high-level meeting, one of the big criticisms in the years subsequent has been that only a very small number, for example, of the national plans, I believe it was 11%, were actually funded from 2016 to now.
Yeah.
So how are we going to move the needle on this funding piece, both for that, going down to member state level with all the complications that you just spoke about in your remarks, in the product development space, in the conflict space? How are we going to work together to try and refocus this financing environment? There's been allusion to push and pull incentives, so in the development part, which come largely state funding, either to fund research and development or to help to procure at the end once a product is developed. And there's been a discussion of mechanisms that need to be put in place at a multilateral level to support countries that don't have the financial resources themselves to put in place their national plans. So how are we going to bring all that together to make sure it really is different this time?
Yeah, maybe I can start off with that. Yes, the declaration did mention the need for 100 million to be raised to support at least 60% of countries to implement their national action plan by 2030. Of course, as you rightly mentioned, since 2016, despite all the efforts and despite all the progress in developing action plans, because literally almost all the countries actually developed a national action plan, at least 178 of them reported directly to the quadripartite. And we keep track of it. It's evidence-based. We have to have the action plan before we agree that this country actually has it. Now, as you did mention, only 11% reported that their action plan had allocated funding to implement it, which was also worrying. Now, even this was as of November 2023. Now, 2024, we looked at the data and it is even tending towards a decline, something around 9% now, which is really worrying. But this 100 million is not like the only source of money that the declaration talked about as well. It's both international funding as well as domestic resources, and also leveraging other sources of funding, such as the Global Fund, the Climate Fund, and the Pandemic Fund, and so many other funding that should be harnessed to support AMR. But one important one that relates to the 100 million is the AMR Multi-Partner Trust Fund, which was established in 2019 following the second ministerial meeting. And that fund, from 2019 to date, only raised 34 million and supported 14 countries, and also 4 global projects that is meant to support all countries. So 100 million is actually not much, but it is a step forward. What it means is that we have to really work hard now to broaden the resource partner base, because so far the fund only had 4 countries contributing to the fund. 5th one is the European Union. So 5 entities contributing to the fund. So we need to expand the donor base. That's what we have to aggressively do through a very coherent resource mobilization strategy. And we need the help of everyone to do that. But as you know, it is also not sufficient to do anything for, let's say, 60% of 194 countries is like more than 100 countries. So it's not enough if you split 100 million it won't go any far. So it can only play a catalytic role. It can only play a catalytic role. That is galvanizing support within these countries and kind of making a compelling case, investment case for these countries to incorporate it into the broader development agenda of the country so that it can be funded. Having said that as well, it is important to note that so far, again, the donor community, there are some signals of, a bit of reticence, competing demands from multiple programs, from the geopolitical situations that we have talked about, the conflicts and so on. So it is not going to be an easy terrain, but we need to mobilize.
Thank you. Damien.
Yeah, I just want to mention that there are a couple of studies out there about how we could put together appropriate financing mechanism. Just a few that have come through and that I read came from the CGD, the Center for Global Development, and that wrote about a fair share contribution from different countries to be able to fund pool incentives. There is also the study by the OECD that found that if developed countries were to contribute 0.0007, I hope I'm not missing 10% of the GDP, that will be another options. So these are theoretical analysis, but I think there are multiple actors thinking about how we can get there and putting options on the table, and will be up to member states and all stakeholders to identify the most viable options.
Okay, thank you. Richard, can I ask you to be brief so that I can take
very quickly.
the questions?
George Sampson's spot on. It's a drop in the ocean. But I think here's the question. If you take all health and economic funding as fungible, this is about political prioritisation in countries. And secondly, rather lastly, the liquidity and debt problems are so severe in many countries now. I think, the AMR issue is being thrown into funding in national systems along with a whole load of other big problems. And unless that is sorted out, a lot of countries we're talking about here are still not going to be able to prosecute their AMR plans properly.
Yeah, and just to quickly add that, for that reason also, the focus of the efforts will be on those who cannot afford the low and middle income countries.
Thank you. So one question here and one question here. There's a microphone coming.
Thanks very much. I'm Sari Moon with the Global Health Center. I have two questions. I think this is a really important effort indeed to bring some of the conversations from New York back into the Geneva Global Health community, but also to highlight an angle of the issue, which is the conflict-related angle that I think has not gotten very much attention in discussions on AMR. So I'd like to pose two different questions on both of those angles. My first is regarding the very high use of antibiotics in livestock raising. And I'm wondering if there's been any shift in the politics around that, because I think so far there has been very limited political willingness on the part of those who raise livestock, countries that rely very heavily on livestock exports, for example, meat eaters. I mean, of course, we all have a role to play in this, but my perception of the politics is that it hasn't changed much, and I hope I'm wrong, and I'm wondering if you could bring us up to speed. Do you see a greater willingness to actually regulate better the use of antibiotics for growth promotion, for example, or is that still a very difficult and live political issue? My second question is about the conflict angle, because I think that's probably one of the most, for me anyways, one of the most troubling and novel and poorly understood aspects of the AMR issue. And I'm wondering, what does that actually mean? Because I doubt that those who are directly engaged in armed conflict care about long-term, slow, silent effects on health that might be caused by fast, loud war and the use of heavy metals, weapons, etc. And what I'm trying to say is the political feasibility of getting people who are directly engaged in armed conflict to care about AMR seems low at best. What does that mean for the rest of us? What does that mean for the global health community? Do we need to invest more in developing drugs for antibiotic resistance caused by weapons? I mean, is that something that is neglected? Is that a neglected R&D priority? Does a quadripartite now need to include the Security Council? And I'm being a little bit, provocative here, but are we actually paying enough attention? What do we actually do about this increased understanding about the link between armed conflict and AMR, which I think is rather neglected in the discourse?
Thank you. Is it related? So
May I just build
maybe
on Suri's,
one second.
not
Pass
by
the
chance.
microphone and then-
Yeah, I just want to further complexify.
So, livestock,
Thank you, no, but I really
conflict, and
I really want to build on Suri's twofold question. My name is Nicoletta Dentico, and I lead the Global Health Justice Program at Society for International Development. On top of what has been just asked, of the many things one could ask, and thank you for your presentations, Professor Nguyen and others have said environment is at the center. Yeah. So let me share my first kind of emotional prologue. Yes, short, that AMR cannot be considered a disease like the other pandemics, okay? And I think we needed to have this systemic approach that the environment entails. Maybe we should start thinking about AMR and debt cancellation, because you come from Africa, you know very well that many countries can neither afford to invest in health, and they have to actually incorporate, in order to pay for their debt, the industrialized model of agriculture and animal farming, which is at the core, the elephant in the room. So this is my first, I think bringing, in between Geneva and New York, maybe it's important to also consider AMR in relationship with the UN negotiations on the economic justice agenda, tax convention, debt restructuring that is going on, because AMR being a long-term journey, maybe it's important to associate that thing. Okay. The second thing I want to say, is the role of multi-stakeholderism in the private sector. Let me be kind of provocative here. Those philanthropic actors that are today funding global health and public and private partnerships are the same philanthropic actors that are promoting industrialized agriculture in Africa, for example. So we have a slight contradiction, which I ask you how you resolve. And finally, are we sure that AMR could not be also the opportunity for a rethinking of the pharmaceutical R&D and production method? Meaning that after COVID, we should have learned that it is the public sector that we need to rely when, the crisis comes to the real problem. And I think it's time to think about a public pharma model to face these very long-term and systemic problems. Thank you.
okay. So, livestock.
So maybe since this is a core priority of the quadripartite, I can take that up in terms of the issue of the high use of antimicrobials in livestock production and even in other food animal production. Now, this is something that is a priority, especially to FAO and to WOA, the World Organization for Animal Health. And for that reason, the World Organization for Animal Health has been monitoring this trend over the last maybe more than 10 years, because there is a report called the use of antimicrobials in animals, animus, they call it, of which they just published the 8th report in the series. Now, from that, it is still a problem, but the good news is that they have also reported that they are seeing a declining trend, especially over the last 5 years. There has been a declining trend. So that is the good news. Again, is that like comprehensive? No, there is an initiative launched by FAO recently, which is a 10-year initiative called the RenoFarm, which is reducing the need for antimicrobials in the farm, RenoFarm, which aims to achieve just that. They just launched it this year, and it is for a 10-year program. It is aimed at helping farmers to improve farming conditions, the sanitary condition of the farm and practices in general, so that it minimizes infections within the farm and therefore minimizes the need for farmers to use antimicrobials. So we hope that this will be a kind of a very critical approach that will help us to achieve a reduction. But again, it is something that it remains to be seen, but we are hopeful that this will work. One critical factor, again, talking about the equity issue, is some of the system transformation that is needed to actually minimize the infection within the farms. Most of the low middle income country farmers are saying, how can we afford this? Because it takes some investment to really raise the standard of the farming conditions to actually achieve that infection reduction. So this is something that, again, talking about how whether or not AMR should not be seen as a development agenda that requires to link it with debt forgiveness and so on, I think that is a conversation that is worth taking forward.
And Prime Minister Motley also in her comments talked about the new role, the regenerated role of the World Bank going forward in global health, and that potentially that could be linked exactly to this topic.
And even the fourth ministerial conference is considering that very seriously in terms of engaging the multilateral development banks for a more sustainable financing of such initiatives relating to AMR. So we'll see what comes out of the ministerial conference, but that is going to be something very important as an outcome of that.
Thank you. Damien.
Yes, I think the decrease in trend of use of antibiotics in the livestock sector that Dr. Samson has also mentioned is seen, and we've started to see a few cases of best practices. I mean, one that I can call out as we are here in Switzerland is even this country. I mean, the data that we're getting from the Federal Office have shown a radical decrease from up to 41% of use of antibiotics in the veterinary system for over the last 10 years in Switzerland. So I think this is a concrete case that shows that it is possible to decrease the use of antibiotic.
Thank you. And Richard, if you could take on the big geopolitical question.
Yeah, thank you, Suri. Look, I guess the worrying thing is if you read the kind of, the academic literature and the kind of forward planning literature from NATO, the Chinese, etc., the view is for the next 10 to 20 years, we're going to be looking at this sort of intensity conflicts around the world. That is a massive problem. That is a massive problem because irrespective of what we manage to do in permissive, stable countries, we're going to have these incredible bi-incubators going. And there's been lots of quiet discussion, okay, as MDROs migrate out of the conflict zones, how do we get the isolates? How do we track them? How do we track patients, etc.? But as we all know, that leads into issues of significant discrimination as well, where this is concerned. So, and no one's really thought through the consequences. At the moment, there are some programs ongoing that no one really talks much about. But the reality is we do have a really substantial problem. And the problem is we haven't thought this through because it's not just a security sector problem or civilian. This is a general civ-military problem. And neither side is very good at talking to each other when it comes to these sorts of what we consider to be global health security issues writ large. And I would argue it's not just for AMR, it's also for pandemics and general within the resilience system. And again, people are kind of skirting around the outside of this at the moment.
Yeah, maybe one quick one that I can say, an initiative of the quadripartite. Last year, in May, we brought together the regulators of medicines from all the countries for animal health and for human health. And this is the first time that these two meet together to discuss, AMR and their roles in their respective countries and how they should actually collaborate at the country level to address some of this, because it was surprising that many of them said really that this is really an eye-opener for them, especially on the animal health and plant sector. So 2023 last year was when we had it in May. We have a plan to have it again, but this time not just limited to the animal health and human health, but also to bring in plant health and environment. So I think that will make it a bit more comprehensive to look at it also from the system and regulatory point of view.
Thank you. If somebody's got one promise to be short question, I'll take. Yes, sir. But promise it short, please.
Yes, it's short. I'm Robert Boss. I used to be the head of the water and sanitation program in WHO. And there's
the microphone's just coming so the online audience can hear you too.
Okay.
I
was in WHO, water and sanitation, and there's one issue that I don't see, because I want to thank the panel for explaining and clarifying the issues around the amplifying effect of conflict ecosystems on the promotion of AMR. But then in that context, my question is, what are the driving forces? Because we heard some sort of mention, there's, maybe lack of insight or lack of time of medical staff to really pay attention to it. There's breakdown of the regulatory systems. There may be a lack of microbiologists to actually investigate situations like that. But there's also, as we know, and that's why UNEP is part of this. Yeah, sure. Why UNEP is part of this, the environmental part is also the genetic transfer of material between bacteria, which may happen in situations where wastewater treatment plants are broken down, etc. So is there insight into the driving forces in these situations?
So it has to be a very short
Yes, very short. Actually, yes, because in conflict situations, the health facilities don't function normally in most cases, because sometimes they are destroyed, the systems are destroyed, but also you are dealing with refugees, displaced persons who have to now live in unusual conditions, very crowded and so on. So, like it was mentioned, it is really an incubator of disease. But what happens also is that some of the preventive measures are also not going to be there. There will be no vaccination programs, it may be broken, and so on. So IPC and water and sanitation is key, and it's one of those to be affected during conflict. So even as a priority intervention in conflict situation is first of all to look at having clean water, but also improving sanitary conditions.
So I want to thank all of you so much for your contributions. We have, I think, really put very much on the table today just how complex this topic is, but how many parties are working towards 2024. You said it's the year of AMR. We hope that 2025, 2026 and carrying on will be. And I would like to leave you from the panel point of view with just some more words from Prime Minister Motley. From her speech in New York, she said, "This is as much an existential crisis as climate." So I think we've seen that, unfortunately, in spades today. And she also said, and this is my message, and I hope the message I can convey on behalf of the panel as well to all of you, let this be owned not by governments, but by the people of the world. So please go out, talk about this event, share in your communities, and let's work together to try to improve. And I will hand over to Vin Kim, who'll make some concluding remarks. Thank you.
So I think we've heard a lot about conflict, and I'm oddly encouraged because one gets the sense of a very high level, not just politically but intellectually, engagement with what's a very, very complex problem. And as our last questioner pointed out, the mechanisms there's the research into this actually is fascinating from a basic science perspective, particularly what we've learned in terms of genetic transfer in environments. But I will move on to invite you to join us for the next webinar that we'll be holding. It's entitled, and in a similar theme, Health Diplomacy in War and International Conflict. So really getting at the heart of the issues of geopolitics and global health. And I think we all know that global health is now a geopolitical playing field. Various countries and blocs are jockeying for influence through global health. So we will be holding this webinar on the 29th of October from 1400 hours to 1530 hours Central European Time in collaboration with the Health Diplomacy Alliance. You can stay informed about all future events by registering to the Global Health Platform's newsletter at ghplatform.org. And as I mentioned earlier, the recording of this event will be available on that website in a few days. And very important, in a moment, all of you joining online will be directed to a very short survey. Please take 30 seconds to answer it. It's very important for us. We use it in our programming, and we really do take your answers very seriously. And for those of you who are here in person, that seems a little unfair, actually. If you're here in person, you get to come up for drinks and something to eat. And if you're online, you have to fill out a survey. Maybe we should make these people fill out a survey before they get any food. So I wanted to thank, we have a fantastic team here who are putting together these events. I don't do much, to be honest. They do all the work. Ellen Roskamp, Bettina Zago, Erica Schnurbarger, and Tomas Morotovich. So thank you to all four of you. And we hope to see you at the next event and upstairs for snacks.